A sickly sweet rot that does not belong in a clean ward in the middle of the United States. Under the thin blanket, the German prisoner of war flinches as hands pull back the fabric, revealing bandages so soaked and stiff that they peel away like old bark. The young man grips the edge of the metal frame, his knuckles white, his jaw trembling, trying not to make a sound in front of his captors. But when the last layer comes off and air touches the open wound, he sees something he cannot pretend is just a scratch anymore. Down in the tunnel of ruined flesh, past the yellow pus and angry red streaks, there is a pale shape that should have stayed hidden inside his body. The rot has reached his femur bone, and in that moment, in a bed thousands of miles from home, a German soldier finally breaks. The ward sits on the edge of the camp, a long wooden building with whitewashed walls, open windows, and rows of metal beds that line up like soldiers on parade. Outside, the fences, guard towers, and warning signs remind everyone that this is still a prisoner of war camp. Even if the inside of the hospital smells more like antiseptic and boiled linens than barbed wire and rifles. The United States medic on duty has already changed bandages, checked temperatures, and listened to the quiet coughs of men who once wore enemy uniforms. By the time he reaches the last bed on the row, he believes he knows what to expect. A tired face, a polite nod, another wrapped limb. Instead, he stops 2 steps short because the air around this bunk feels different. It carries a heavy odor that instantly makes his stomach tighten, the unmistakable warning of deep infection that no blanket can hide. On the bed lies a young German private whose name sounds sharp and foreign to the American ear, something the staff still mispronounces after weeks of trying. His hair is thinner than it should be at his age, his cheekbones too sharp, his eyes ringed with the gray color of constant pain and bad sleep. He keeps his gaze fixed on the ceiling as if he has practiced this moment, as if pretending not to care can somehow protect him. The medic glances at the chart clipped to the bed frame. It notes a shrapnel wound to the thigh from months earlier, treated in a field dressing station somewhere in Europe before capture, then wrapped and rewrapped during transport. On paper, it is old damage that should have been healing. In the air, it smells like something that has been quietly dying. When the medic tells him he is going to change the bandage, the prisoner stiffens. He tries to sit up, then thinks better of it, propping himself on his elbows instead. His hands grip the edge of the thin mattress, fingers pressing into the coarse fabric. Guards at the door shift their weight and watch, but even they wrinkle their noses. The medic speaks slowly, choosing simple words, making sure the prisoner understands. "This will hurt. We need to see." The prisoner answers in broken English and scattered German, nodding, insisting that it is not so bad. The insistence sounds less like confidence and more like a man begging reality to bend. The first layer of cloth comes away with a moist sound, and the medic realizes that part of it has fused to the skin. He has seen infection before, on Allied soldiers in field hospitals and on civilians caught in bombardments, but this feels different. This is the result of weeks of marching, cramped transport, poor hygiene, and the kind of neglect that happens when a wound is covered, forgotten, and left in the dark. Beneath the outer bandage, the wrappings grow darker, stained in irregular patterns. Each inner layer peels back with more resistance, as if the leg itself is trying to hold on to them. The prisoner begins to shake. He clenches his teeth as the medic apologizes and continues. One guard looks away. Another watches, jaw tight, as if forcing himself to witness the consequence of a war he did not start. Just when it seems that the last layer has been removed, the medic sees another strip of cloth stuck deep in the wound, buried among crusted discharge. He has to tug hard, and when it finally comes free, a thick stream of pus breaks loose, followed by a slow, steady ooze of blood. The smell intensifies and the prisoner gasps, his facade cracking for the first time. His chest heaves, his eyes clamp shut, and a broken word in German slips out, something between a curse and a prayer. In the narrow ward, time seems to shrink to the space between the open wound and the medic's gloved hands, to the realization that this leg is not just injured. It is being eaten from the inside. We are in a camp hospital in the United States near the last phase of the war. Now we go back to how this young German reached this bed with rot in his thigh. Months earlier, on a wet and smoky battlefield in Europe, he was not a helpless patient. He was a soldier in a unit already worn down by retreat, hunger, and the constant thunder of artillery. During one chaotic afternoon, as he crouched in a shallow trench, a shell exploded close enough to send splinters of metal flying low across the ground. One piece sliced into his thigh, hot and fast, punching through muscle and leaving a ragged tunnel that he barely had time to notice before the world dissolved into noise and dirt. In the confusion, he felt only a burning line and a rush of heat. Adrenaline, training, and the shouted orders of his sergeant made him tie a quick field dressing around the wound and keep moving. The nearest aid post was overwhelmed, its staff struggling to keep up with the stream of wounded men. When his turn came, the wound received a hurried cleaning, a splash of antiseptic, and a bandage wrapped tight to stop the bleeding. The medic at that station meant well, but he was exhausted, under constant pressure and working with limited supplies. In war, not every wound gets the attention it truly needs. Some are simply covered and sent back into the line. Days turned into weeks. The German soldier marched, dug, and slept in damp foxholes. The bandage, once white, turned stiff and stained, but as long as he could walk, nobody considered him a priority. The pain in his leg became a constant companion, a dull throb that flared with each step. When he finally reported to a company medic again, the line of wounded ahead of him was long. He received another quick inspection and a fresh wrapping. No one cut down to the bottom of the wound to see what was happening beneath the layers of cloth and dried blood. When his unit finally encountered Allied forces that pushed hard enough to break their defenses, everything collapsed in a matter of hours. Shellfire, smoke, shouted commands, and rumors of encirclement turned order into flight. The young soldier found himself in a field, his leg heavy and hot, his mind hazy with pain and lack of sleep. When the shooting stopped and Allied troops closed in, he raised his hands not because of fear, but because his body had reached the limit of what it could do. His capture was less a decision and more a surrender to gravity and infection. In that moment, his most dangerous enemy was no longer in front of him. It was inside his own thigh. Let us know in the comments where you are watching this from. Are you in the United States, Germany, the United Kingdom, or somewhere else? If you want to dive even deeper into these untold stories, consider becoming a channel member. You'll get your name mentioned in the video, early access to videos, exclusive content, and direct input on which stories we cover next. Join our inner circle of history keepers. We are leaving the battlefield in Europe and following him along the transport chain that carried prisoners across continents. Now, we go to the ships and trains that brought him to the United States camp. After capture, he joined thousands of other German prisoners of war in makeshift holding areas behind Allied lines. Barbed wire appeared in new shapes, this time forming enclosures for men who had once believed the fences would always hold someone else. Medical staff walked among them, looking for obvious injuries, severe bleeding, or immediate surgical cases. His bandaged leg earned him a glance and a note, but not yet a stretcher. When the order came to move, the prisoners marched to the railhead, their belongings reduced to what they could carry. For many, that meant a few personal items, a blanket, and the clothes on their backs. His leg protested with every step, sending sharp reminders through his body. The bandage, now old again, rubbed against raw flesh. On the crowded train, there was little room for personal space, let alone proper medical care. Men slept sitting up, leaned against each other, and tried not to think about how far they were from home or where they were going next. At the port, the prisoners saw ships that would take them across the ocean. Some had never seen such large vessels before. The journey by sea added a new layer to their disorientation. Below decks, the air was thick with sweat, salt, and the nervous energy of men who had lost control over their fate. The German soldier's leg grew worse in that confined space. Red streaks crawled higher up his thigh, but he told himself it was just irritation. He did not want to be left behind with the severely wounded or the dying. To many captured soldiers, staying with the group, even in misery, felt safer than being singled out. On board, Allied medical personnel kept an eye on fevers, coughs, and signs of contagious disease. They were responsible for men who had recently fought them, but they followed the rules of the Geneva Conventions that demanded humane treatment of prisoners. Still, with so many bodies in close quarters, some conditions escaped attention until they became impossible to ignore. A bandaged leg, hidden under a blanket and a layer of stubborn pride, could easily blend into the background noise of war injuries. When the ship finally reached the United States, the prisoners disembarked into a world that felt unreal. The war they had known was across the ocean, but they were still not free. Trains took them deeper into the country, through landscapes they had never imagined seeing in person. Fields, small towns, and distant cities flashed by, framed by the barred windows of transport cars. At one of the large prisoner of war camps, guards directed them into lines, counted them, assigned them barracks, and sorted those who needed medical evaluation. By the time the German soldier reached the camp infirmary for the first time, his leg had carried him through continents. Now, each step felt like it was grinding bone against something rotten. In the camp, routines quickly formed. Prisoners woke, ate, worked, and reported for roll call under the watchful eyes of guards. Some were assigned to work details outside the camp, laboring in fields or on construction tasks under supervision. Others, like our young German with the injured leg, found themselves in a gray zone. He was not healthy, but he was not bedridden either. So he tried to prove he could still contribute, hoping that being useful would earn him better treatment or at least help him keep some sense of dignity. Every few days, he returned to the infirmary for fresh bandages. Each time, the staff removed outer layers, cleaned what they could see, and wrapped the leg again. The deeper infection remained hidden, like a slow-burning fuse. We are back in the camp hospital ward in the United States, on the day the medic finally sees the true extent of the damage. As the last of the old bandages comes away, the sight beneath it draws a sharp intake of breath from the staff. Instead of clean, healing tissue, the wound looks like a tunnel carved through his thigh. The skin around the opening is swollen and discolored, shifting from bright red at the edges to a dull purple further out. Thick, yellow pus pools in the deepest part, streaked with gray. Tiny bubbles form as trapped gases from the infection escape. The medic knows that this is not a simple surface problem. The smell confirms it, a sickly sweetness mixed with decay that he has learned to associate with aggressive infections that can spread into the bloodstream. He gently irrigates the wound, flushing out as much of the discharge as he can. With each rinse, more of the hidden cavity reveals itself. At first, it looks like more damaged tissue, inflamed and fragile. Then he sees a pale, solid shape at the bottom, something that reflects the light in a way no muscle ever has. It is bone. The femur, the strongest bone in the body, is now exposed to open air and bacteria. The German prisoner sees the medic's expression change, and the fragile dam he has built around his fear starts to crack. All this time, he has told himself that the pain meant healing, that the throbbing and throbbing meant that his body was fighting back. Now, the bare presence of his own bone staring up at him from inside a hole in his leg shatters that illusion. He realizes that this is not just about walking with a limp. It is about whether he will walk at all, whether he will keep the leg, and whether an enemy doctor will decide that he is worth saving. The idea of losing part of his body in a foreign land, far from family, hits him harder than any shell burst. The medic calls for the camp physician, his voice calm but urgent. When the doctor arrives, he does not bother hiding his concern. He examines the wound closely, probing gently with sterile instruments to assess how deep the infection has gone. He speaks to the medic in English, using words that the prisoner does not fully understand but can feel in the room. Bone infection, osteomyelitis, risk of sepsis. The German prisoner catches only fragments, but the tone is unmistakable. This is serious. This is a fight between modern medicine and decay. When the doctor addresses him directly, he slows his speech and uses simple phrases. He explains that the infection has reached the bone and that they will have to clean it deeply. There is a chance they might still save the leg, but it will not be easy. It will hurt. It will take time. The prisoner, who has spent months trying to appear brave in front of comrades, guards, and strangers, suddenly feels his eyes fill with tears. They spill over before he can stop them. For the first time since his capture, he cries openly, not for the fatherland, not for lost battles, but for his own body being eaten from within. He covers his face with his hands as silent sobs shake his thin shoulders. In this camp, the German prisoner is only one of thousands of men processed, housed, and treated by American staff. Across the United States, prisoner of war camps held hundreds of thousands of enemy soldiers during the war, each with their own injuries, diseases, and silent fears. Many arrived with wounds that had been neglected in the chaos of retreat and capture. For medical staff, every patient was part of a larger pattern. They saw bullet wounds, shrapnel injuries, frostbite from winter campaigns, and infections born in trenches, transport wagons, and prison trains. Behind each individual case were numbers that told a broader story. There were statistics on how many prisoners required surgery, how many needed amputations, and how many developed serious infections that reached the bone or bloodstream. In some hospital records, you can trace how often osteomyelitis appeared in prisoners with untreated or poorly treated combat injuries. These numbers remind us that our German prisoners' suffering was not an isolated tragedy, but part of a wider medical challenge facing camp doctors. They were tasked with preserving the lives and limbs of men who had once been trained to kill their countrymen, all while maintaining standards that would be judged after the war. At the individual level, the soldier's world shrank to the few digits that mattered most to him. How many days until they tried the first major cleaning? How many degrees his fever climbed when the infection flared? How many hours of sleep he lost to pain and anxiety before each dressing change? For him, the statistics of war narrowed down to the length of his wound, the depth of the cavity around his femur, and the possibility that a surgical saw might one day be his only escape from the rot. These numbers also spoke to questions of survival. If a certain percentage of deep bone infections led to amputation, he could not help but wonder which side of that percentage he would fall on. If most prisoners who received aggressive treatment in time could keep their limbs, he had to trust that being in this American hospital, instead of on a battlefield or in a collapsing field station, gave him a better chance. The doctor, aware of these patterns but also aware that each man is more than a statistic, chose to focus on what he could control in that moment. Cleaning the wound, fighting the infection, and giving this prisoner a chance to be more than a number in a post-war report. We stay in the ward as the medic and doctor prepare for the first serious attempt to clean the infection around the femur. The German prisoner lies on the bed, watching as instruments are laid out on a nearby tray. Metal gleams under the lights. Gauze, forceps, scissors, and irrigation syringes line up like a silent promise that this will not be quick and it will not be gentle. The doctor explains again what will happen. They will numb what they can, but the nature of the wound means that some pain is inevitable. They need to remove dead tissue and clear out as much infected material as possible. The prisoner nods, but his hands betray him. They tremble as he reaches for the bed rails, gripping them so tightly that his fingers blanch. The medic offers him something to bite down on, a folded cloth that will at least give his jaw something to focus on when the worst moments come. Outside the windows, life in the camp continues. Prisoners file to work details, guards walk their patrols, and kitchens clatter with the sounds of meal preparation. Inside this small room, the war has distilled into a battle measured in millimeters and seconds. When the doctor begins, the first sensation is a sharp sting as the anesthetic goes in around the wound. The prisoner flinches, then breathes through his teeth, counting in his head. He counts to distract himself from the awareness that they are preparing to dig into his flesh. The numbness spreads slowly, but not completely. When the doctor starts to cut away dead tissue, the German feels pressure, tugging, and sudden flashes of pain that cut through the haze. His body arches involuntarily with each spike. The medic speaks to him in a low, steady voice, telling him when a particularly difficult part is coming, warning him just enough so it does not take him entirely by surprise. At one point, the doctor has to scrape along the exposed bone to remove infected material clinging to it. The sensation is unlike anything the prisoner has ever experienced. It radiates deep inside, as if someone is striking the core of his body with a dull chisel. His vision blurs. The room tilts. He feels his grip on the bed rails slipping, not because his hands have loosened, but because sweat has pooled between his skin and the cold metal. He wants to be silent, to prove he is still a soldier, but a strangled cry escapes despite his efforts. Tears stream down the sides of his face, dampening the pillow. When the worst of it is over, the doctor irrigates the wound again, washing out bits of tissue and pus that have been dislodged. The cavity looks cleaner now, but also rawer, stripped back to what they hope is viable flesh. They pack it with fresh gauze designed to absorb discharge and deliver medication deeper into the tunnel. The prisoner lies still, chest rising and falling in shallow breaths. He feels both drained and oddly lighter, as if some of the poison that has been clouding his mind has been pulled out along with the dead tissue. Yet he knows this is only the first round. Bone infections are stubborn. They do not surrender after a single attack. As the German prisoner lies in the hospital bed recovering from the first cleaning, he has time to think about the choices that brought him here and the ones that were made for him. He did not choose the war. He did not choose the battlefield. He did not choose the shell fragment that lodged itself in his thigh. But now, in a guarded room on another continent, he must choose whether to trust the hands of men who wear a different uniform. The doctor and medic have already shown him more care than some of his own army's overburdened field stations could manage. It is a strange feeling to owe your leg, and possibly your life, to an enemy. Let us know in the comments where you are watching this from. Are you in the United States, Germany, the United Kingdom, or somewhere else? We would love to know who is keeping these stories alive. For the prisoner in this story, the question of place has an entirely different weight. His body is in an American camp. His thoughts drift back to a village in Germany, and the infection in his leg does not care about borders or flags. It only knows how to spread. As the days pass, he begins to notice small signs of change. The fever that once made his thoughts swim starts to break more often. The throbbing in his leg shifts from a burning ache to a duller, more manageable pain. These tiny improvements matter to him more than any victory speech broadcast over the camp loudspeakers. He also notices small changes in how the staff treat him. The medic, who once saw a chart and a wound, now sees a person with a story. He learns that the prisoner has a younger sister back home, that he used to help his father in a workshop, and that he wanted to be an engineer before the war swallowed his plans. The guard at the door, who used to glance in only to count heads, starts to linger for an extra moment during shifts, listening to the quiet exchanges between patient and staff. In a place designed to hold enemies, these human details start to soften edges that barbed wire cannot reach. We stay in the camp hospital as the days turn into weeks of slow, careful treatment. The German prisoner submits to repeated cleanings, fresh bandages, and courses of medication aimed at killing the bacteria trying to claim his bone. Each procedure hurts, but none as much as the first deep cleaning. He learns to read the expressions behind the masks, to recognize when the doctor is pleased with progress and when concern flickers in his eyes. The wound still looks raw, but the angry redness around it begins to fade. The discharge thins. Signs that the body is fighting back begin to outweigh signs that it is losing. For the United States medic, this case becomes more than a line in the logbook. He has seen what happens when infections like this go unchecked. He has stood in operating rooms where surgeons had no choice but to remove limbs to save lives. The memory of those amputations hangs over his work with this patient. Every time he changes the dressing and sees a little less exudate, every time the prisoner's fever stays down overnight, he feels a cautious sense of relief. He does not say it out loud, but he is rooting for this German's leg as if it were his own. The prisoner senses this. At first, he watched every movement with suspicion, waiting for roughness or indifference. Instead, he found a level of care that surprised him. The medic explained each step, warned him before painful moments, and never mocked his tears. Over time, the prisoner begins to speak more openly. He admits how afraid he was when he saw his own bone. He confesses that the breakdown in the first cleaning was not just about physical pain. It was about realizing how close he had come to losing part of himself without ever seeing home again. In return, the medic, within the limits of camp regulations, shares small details about his own life. A town he misses, a sister who writes letters, a normal world waiting on the other side of the war. This fragile trust does not erase the reasons they ended up on opposite sides of a battlefield. It does not erase destruction, propaganda, or the suffering inflicted in other places. But in this room, the conflict has narrowed to a simple question: will this leg heal or not? The German prisoner begins to feel gratitude toward the very system he was taught to hate. He wonders, in quiet moments, how he would have been treated if the positions were reversed. Would a German camp doctor have fought as hard to save an American prisoner's leg? The answer is not simple. Records from the war show both cruelty and compassion on all sides, sometimes within the same institution. Even as the wound improves, the possibility of amputation never fully leaves the room. The doctor has been honest from the beginning. If the infection fails to respond, if it spreads further along the bone, they may need to remove the limb to keep the prisoner alive. The German knows this, and the thought sits in the back of his mind like a shadow he cannot shake. He imagines himself returning to Germany on a ship, moving on crutches or with a wooden prosthesis. He imagines the reaction of his family, the adjustments he would have to make, the jobs he might never be able to do. The camp doctor watches the charts and the wound closely. Each sign of progress pushes the scale away from amputation. Each setback nudges it back. A slight rise in temperature. A day when the discharge looks thicker. A new streak of redness along the skin. He knows that acting too late could mean losing more than the leg. Bone infections can seed bacteria into the bloodstream, leading to systemic collapse. Acting too early, on the other hand, would mean condemning a man to life as an amputee when a few more days of treatment might have saved the limb. In meetings with other medical staff, they discuss cases like this in clinical terms. They talk about risk factors, possible interventions, and available resources. But when the doctor returns to the bedside, the conversation changes. He sees not a case study, but a man who has already lost so much. He tries to balance honesty with hope, giving the prisoner enough information to understand his situation without drowning him in worst-case scenarios. The German appreciates this. He has experienced the opposite before, when officers made optimistic speeches while front lines crumbled. Here, the truth comes with clear actions attached. For the medic, the tension manifests in simple routines. Every time he unwraps the bandage, he braces himself. Every time he sees clean tissue where rot once dominated, he allows himself a small exhale. The German learns to watch his face for clues. A slightly relaxed jaw means good news. A tight, furrowed brow means something has changed. In this silent exchange, the progress of the wound becomes a shared journey rather than a private torment. The risk of amputation remains, but with each passing week, it becomes less likely. The war outside still rages in distant theaters, but inside this ward, the fight is turning in their favor. As we follow this fragile recovery, we are also following one of countless untold stories from World War II prisoners of war. Many never spoke about their injuries or their time in enemy camps after the war ended. Some carried scars, missing limbs, or quiet nightmares that their families only partially understood. Others lived with hidden reminders like chronic pain or recurring infections that traced back to a single wound years earlier. If you are enjoying this story and want more untold accounts from World War II prisoners of war, make sure to subscribe to the channel. We are bringing you stories that most history books never covered. Each subscription and each view helps keep these complex, often uncomfortable memories from fading completely. Behind every statistic, there is a human being who faced choices, fear, and pain in circumstances most of us can barely imagine. Returning to our German prisoner in the camp hospital, his story is far from over. Healing a bone infection is not just about bandages and medicine. It is about what happens to a person when their body, their identity, and their beliefs are all challenged at once. We remain in the camp hospital, but the calendar moves forward. Outside the walls, news filters in about major battles, changing front lines, and political decisions that will shape the end of the war. Inside, the daily rhythm of the ward remains steady. Nurses change linens, medics move from bed to bed, and doctors make their rounds. The German prisoner watches new patients arrive and others leave. Some come in with broken bones from work accidents, others with respiratory infections or stomach illnesses tied to the stress of captivity. As his leg slowly improves, he notices that he is no longer the most fragile figure in the room. A new arrival with a chest wound coughs through the night, each breath sounding like a struggle. Another prisoner lies with both arms in casts after a transport incident. In this environment, suffering is relative. He begins to see his own survival as part of a larger web of endurance shared by everyone in the ward, regardless of uniform. The fact that enemy doctors are the ones keeping that web from tearing still feels strange, but less shocking than before. Repetition has a way of turning the extraordinary into the everyday. The medic uses these calmer days to encourage the prisoner to move his leg in small ways. Carefully, within the limits set by the doctor, they adjust his position, ask him to flex his foot, and later, to lift his leg slightly off the bed. Each small movement is both a test and a symbol. The German feels returning strength, but also the lingering stiffness of muscles that have not worked properly in months. He learns how quickly the body forgets simple actions when pain has dictated stillness. At the same time, he feels grateful that these are the problems he faces now, rather than the more final problem of an absent limb. As his condition stabilizes, the German prisoner finds himself thinking more often about home. He writes letters that may take weeks or months to reach his family if they arrive at all. In them, he tries to explain the strange reality of his life. Held in a camp by former enemies, yet treated in a hospital that fights to save his leg. He chooses his words carefully, aware that censors may read every line. He does not describe the worst moments of pain in detail, but he hints at them, hoping that his family will understand the seriousness without being crushed by worry. He imagines his mother reading the letter at a kitchen table, perhaps in a house already damaged by air raids, or in a village straining under shortages. He imagines her trying to picture an American hospital ward, a place she has never seen and only knows through rumor and propaganda. In his mind, he hears his father's quiet questions. Are they treating you well? Will you come home whole? The prisoner does not know how to answer fully. He can only say that there are doctors, that they care for him, and that his leg is not yet lost. The medic, who sometimes helps translate phrases or explain American terms, understands that these letters are more than simple updates. They are bridges thrown across a chasm of war. For him, the process is also personal. He thinks of letters he has sent home, describing his own work with prisoners of war,